Hello, I'm Brian Hubbard.
And I'm Lynne McTaggart.
And we are What Doctors Don't Tell You. And welcome to this, our latest podcast and webcast, I suppose. Vlogcast, I don't know. Anyway, we've been publishing What Doctors Don't Tell You since 1989 when we were mere children. And we've been publishing every month since. It is now a glossy and wonderful magazine for those who are watching on YouTube. I'm just holding it up. Available in all shops, but subscribe as well. You can find us on WDDTY.com. And
we're available in America as well as the UK and in 15 other countries around the world.
So there you are. So no excuses. So what we do every time with the podcast is natter. Really, we natter about the news and interesting things that have come to our attention. And all the years we've been researching, we always feel we have something useful to add to the debate.
For those in America, by the way, natter equals, we chew it over a bit. We jaw about it.
So thank you for that translation. And so, first item, let's kick off. Interestingly, one from Goldman Sachs, everyone's favourite merchant bank. And they've come forward with this world-shattering news that if drug companies actually cured anybody, they'd go out of business. And Goldman Sachs and many, many institutional investors have been pouring money into drug companies for many, many years because they're highly profitable, which would also suggest, therefore, they can't be curing anyone. And this all came to light because Goldman Sachs have been sort of umming and ahhing about making major investments into drug companies that are involved in a new form of drug called gene therapy. And the trouble with gene therapy is actually curing people. And Goldman Sachs says, well, that's no good, because you're losing your market every time you cure someone. And they sort of point out one particular therapy that caught his eye, which is treatment for hepatitis C, which was achieving cure rates of more than 90%, 90%. And at the peak, a few years back, it was churning over $12.5 billion in sales. Unfortunately, this year, sales will be down to $4 billion because the market's disappearing because people are being cured of the problem. And they're really urging the drug companies not to pursue this because they're saying it may be fine for society and it may be wonderful for patients, but it sure ain't good for investors, which I think is very interesting because that's always been the issue with drug companies, how they've always had their investors to worry about to ensure there's a good profit, when ostensibly they're actually there for the good of mankind. And it's a terrible stress, and you've got to please one of the two masters.
Well, and I think this is the real nub of it, is should we have a model for medicine that's for profit? If you do, as you say, you're real. The emphasis always has to be on investors. But here's the problem, an even bigger problem with medicine, which is essentially drugs don't cure. I always have a challenge. I've been sending this challenge out since, I think, about 1996, just a few years after we started. And that is, tell me a drug out there, and I'm not talking about gene therapy, that's something new, but an ordinary drug out there that actually cures something besides antibiotics. And antibiotics are actually starting to not work anymore too. But if you think about it, the whole coterie of drugs we have out there don't actually cure anything. They might maintain, they might take away some pain. They definitely are going to cause other kinds of problems with all kinds of side effects, but they don't cure. And that has a lot to do with what Goldman Sachs has said, the whole financial model. You need, as a drug company, two things. A vaccine, because that means a ready market for everybody, particularly a vaccine for babies. Everybody gets it. Or a drug that is for some sort of chronic problem that needs to be taken for life. When you get that kind of thing, it's gold dust. And that's pretty much most chronic illnesses, when they're managed by a drug. So this is the whole crux of why medicine doesn't work. It's relying on a business model, and it's relying on chemistry to try to change something in the body that has loads of other effects. You know, the other big problem with drugs is that they think that if you slot A or tab A into slot B, it's only going to fix that little bit. The problem is that our bodies are so holistic and interconnected that it also affects slot C, D, F, and so on. And so you get all kinds of side effects. So here's a whole bunch of central issues about medicine and why modern medicine doesn't work, Brian.
Okay, and talking about slot A, tab B, or whatever it was, and the knock-on effects, that's already come out in an interesting study that estimates that the cost of drug reactions, side effects, and knock-on problems from pharmaceutical drugs is costing the US $528 billion a year, and which is round about 16% of the total healthcare bill in the States every year. And when you think the US spends more on healthcare than any other country, that's quite an alarming figure. I mean, they're not entirely sure. The figures could even be worse than that. That's an average, they think. At the high end, it could be even $672 billion. And it's all really because people are suffering adverse reactions to drugs. It's all the things you were saying, Lynn, about the knock-on effect that this chemical agent has on a very complex biological system, i.e. us. Also, very interestingly, the researchers who are from the University of California at San Diego are saying that drugs themselves have become a disease because they give one instance, an ACE inhibitor, which is used to lower blood pressure, but it can also cause even something as simple as a cough, right? The cough then requires a cough remedy that includes an ingredient that increases blood pressure and raises the risk of sleepiness and falls. So in all these cases, it's a knock-on effect. And so you get to the point eventually where someone in their 60s plus could be easily on 7 or 8 prescription drugs a day. And of course, again, we don't know the chemical reaction between all of those drugs in that chemical cocktail. But, you know, it's really following on from what we were saying earlier about, you know, how drugs don't actually cure, but they do treat the symptoms. And but with, you know, with terrible consequences.
Well, this is the thing. I think it's so underappreciated. But we now know that, and this was the Journal of the American Medical Association, no less, that drugs, you know, correctly prescribed drugs are the 3rd leading cause of death in America and probably the Western world. Now, that could be even second, but it's just following after heart disease and stroke. And I think cancer was 3rd, but now I think correctly prescribed drugs, iatrogenic disease, doctor-caused disease, is number 3. And it is all about their tools. It's not their intentions and all sorts of things like that. It's the tools they've got. And this chemical agent, as you say, has all kinds of knock-on effects that require other drugs to deal with those knock-on effects. And we do know that polypharmacy, which is what we're talking about, having to take loads of drugs, is standard for the over 50s now. And that is the big concern we have. I like to always say about medicine that if we're talking about emergency medicine, conventional medicine is unparalleled. We get run over walking out of the studio. We want the best of high-tech medicine to put us back together again. But for anything else, most of those chronic conditions, there is a holistic, usually alternative approach that works better in just about every case.